Hi, this is Dr. Clancy, and I want to go over your 45-hour practicum requirement for this course. Remember, this is a 4-credit course, so it's a little bit more work than your normal 3-credit courses. There is a requirement by our accreditors that all students do a 45-hour practicum in the field of community health. Now, community health has a broad umbrella, and it covers a lot of things. It covers employee health, and it covers educating. I want you to, before you begin, make sure you check out the Wheel of Community Health Interventions on page 12, I think, in your book. Yes, and on page 13, there's a little definition for each of them. Just like all our specialties, community health has certain tasks that you become familiar with and you become an expert in. Like in your ICU, maybe starting IVs, working with vasoactive drugs, interpreting a lot of data would be a task you would become an expert in community health. Certainly there's a lot of tasks in pediatrics and labor and delivery, but in community health there's the wheel that's listing them all, and these are the interventions you would use either at the population level or at the community level or the systems level, or you could even bring it down to individual education under the umbrella of the community health. But as I said, you should all have received by now a survey. I'm sending them out today, and today is the 10th of August, and giving you one of 6 choices. There's limited availability at most of the choices. There's the Poison Control Center, which is right in the Jacobson, I think it is. Care Transitions with Diane Nano in the hospital. Employee Health. Flu shots. Flu shots, vaccinations is part of community health. What I would have you do is contact Linda Goff or one of her associates and schedule times, and you would just go to the cafeteria or wherever she's dispensing the vaccinations and be giving vaccinations. I know a lot of these tasks are redundant, but as a community health nurse, you can feel the importance of them. And every time you do any practicum hours, you have to write a journal. So in your flu vaccinations, you might want to do a little research and say, this flu vaccination has a high level of confidence to be effective, or maybe it doesn't. Maybe you want to talk about the vaxxers, who doesn't get vaxxer, or what was the population like that showed up when you were giving shots? Were they mostly white middle-class people, or were they people from your work site that were very diverse from all levels of employment? So when you're doing your activity, think of some of those things. Temperature screening. Unfortunately, we've got a lot of places to do temperature screening. Temperature screening, you go over the signs and symptoms of COVID. They will become deeply embedded in your you'll go over, did they travel? At every temperature site, there's a list of states that if they traveled, then they need some more follow-up from in the last 24 hours. Then in the last 2 weeks, I'm sorry, then they're going to need a little higher level of screening. You might want to look at the R number for that day. What is the rate of transmission? We want to keep R under 1 because that means one person with COVID is not really affecting another whole person. When your R rate is 2 or above, it's amazing how it can cascade and infect many people. So there's some supportive data you can put in your journals to make them meaningful to you. And the Colbit screening is on Water Street. I've done it a couple of times. It is swabbing, but there's also a lot of support work. They'll go over with you how to do a correct swab if you haven't done one in a while. You're all garbed up, and it's outside. You take down information from the person getting the screening, and you give it to another girl to put in a computer, and they print up a label for the specimen. But when you get the specimen, you put it on a certain table. So there's a lot of support work. You might not be doing the swab yourself, but you will be supporting them in some way. There's lots of hours at Water Street, and I hope some of you find that meaningful. I know when we first started swabbing here in Syracuse, I swabbed down at the Community Health Center, and I was stunned at most of the people were from Casanova, Skaneateles, DeWitt. There was very few inner city people that came for swabbing. So what does that tell you as a community health nurse? And what might be some interventions you would want to do to correct that? And then we have another option that you can do at your own community. You can either do it in your own community or at another community that you select. It's to identify a community, do a windshield survey. And a windshield survey, there's information in the course what one is, but you can just Google it. As you drive through the community and you look at things like the upkeep of the community, the litter of the community. Are the sidewalks and roads in good shape? What do the houses look like? Are there stores or is the grocery stores within walking distance, or is everything has to be driven? I think one of the big alarming things I've seen of late in the area is the DeWitt New Library. Now, the library for DeWitt used to be in shopping center on a bus line. People could go take the bus and go to the library. But when shopping town was downsizing and closing, they chose a place down on, I think it's Nottingham Road. You can't even get there by bus. So already, how many people does that leave out of using that library? So everything in community health and everything in your community is connected. If you're looking at your own community, you might want to look at the Robert Wood Johnson culture of health, because they talk to how a culture of health is the only way to make a community safe. Some of the things you can do in your own community is you might want to do a bottle drive. You might want to do a litter type thing. You might want to do a tabling event at the grocery store and teach about HPV, the importance of that vaccine for all boys and girls, teenagers. There's many things you can do, but once you decide if you're going to do a community self-directed project, you're going to have to email me or call me, and we'll talk about it to make sure it meets all the requirements of the course. What people did, students did over the summers, they made posters and put up posters. They had tabling events at grocery stores or at their church to just share information. It's hard now with the COVID-19 exactly what type of interaction you can have. A lot of them worked with, selected their legislator and really worked with informing them on some of the issues around mask wearing. Another student collected gloves and hats and put them at the community health center, so people going in there for appointments just go to the box. And it's funny, I first saw that at Bassett. When you go to the Bassett clinics, they have a big box in all the offices with hats and mittens and gloves for people to just take, because it promotes community health. Somebody else talked about putting sunscreen attached to trees in parks. That again promotes community health. You can be as creative as you want with that idea. But again, you have to accumulate at least 42 hours. 3 hours can be done by doing webinars that relate to community health. And you can certainly email to make sure I approve of the webinar and it meets our criteria. And watch the webinar. The webinar on the Flint water situation, amazing, amazing. I don't know if we really see inequities that happen every day, and we just kind of take them for granted. But these are your 6 choices. Your survey's going to come out. I know some of you might get temp screenings, or some of you might get vaccinations or COVID testing, and you're going to be unhappy with it. But all tasks in our workplaces are not happy tasks. So do the best you can. If it's a grave problem to you, make sure you call and let me know. I want you all to be successful in the course, and I'll do as much as I can to help you be successful. But don't sweat over this 45-hour practicum. I will work with you and help get it done. And again, feel free to call me, or we're going to have some optional class meetings once I get WebEx up and going, and we can talk about it in these optional class meetings. But thank you, and I hope you have fun with your practicum, because community health is such a different way to practice nursing. They look at the community as their patient instead of the patient as their patient, and they believe in the greater good. The good is for the great rather than the individual person. So the book is very good. It gives a good history. I know I was stunned when OSHA didn't come into being until 1970. I was an adult. I had a child by 1970. But then I've gone over to Slovakia after, I think I mentioned this before, after they broke away from Russia, and I was stunned by the number of employee-related accident victims I saw. They had whole hospitals for burnt patients because of the hot steel they make, and no rules or OSHA guidelines at all in some of those countries. So regulations are costly, they're difficult sometimes to work with, but they're there for a reason. It's to keep people safe. Well, again, I hope you have fun. Call me if you want to talk through your community self-directed project, if that's what you choose, or if I don't have any other selections left for people who didn't send in a survey, that you might be assigned that one. But again, it can be a fun thing. The community is where we live, and it's very important for we as nurses to keep it healthy and keep it connected. Thank you.